Can you share the two most common birth injury calls that we get? Yeah, thanks for that question, Renee, my better half and partner in here. The two most common birth injury calls that we get to our office are number one, the overwhelming majority of the calls are traumatic brain injuries. Those are the majority of the calls that we get. And from there, we do get some calls sometimes on shoulder dystocia issues. Shoulder dystocia creates an emergency, and that's really when a baby gets trapped behind mom's pelvis. And the most common issues that you can see from a shoulder dystocia condition are injuries to the nerves in the brachial plexus area of the shoulder. You can have injury there. You can also have injury with the arm in some instances, and even down to the hand. And for shoulder dystocia, sometimes you can even have traumatic brain injuries also from shoulder dystocia. But like I said, the overwhelming majority of calls or birth injury calls are traumatic brain injuries, with the cause of those traumatic brain injuries being oxygen deprivation. In other words, a reduction in blood and oxygen or oxygenated blood, which leads a baby to suffer a traumatic brain injury called HIE, hypoxic ischemic encephalopathy. And in its basic sense, HIE is what I just said, a reduction in blood and oxygen, which can lead the baby to suffer traumatic brain injury. Now, from there, you may be asking yourself, okay, well then, Marcus, what can cause this oxygen deprivation? Why does a baby have oxygen deprivation? There can be a lot of things which can lead a baby to have oxygen deprivation or reduction in blood and oxygen. For example, you can have a uterine rupture, and that is exactly what it says, the uterus ruptures. When uterine ruptures occur, some of the main areas of concern are going to be mom hemorrhaging. If mom is hemorrhaging, that means she's losing blood. And if mom is losing blood, then of course that in some instances can impact a baby. You could also have placental abruption. You can have umbilical cord prolapse. And when you have umbilical cord prolapse, one of the main areas of concern there is going to be cord compression. If the umbilical cord is compressed, then of course that can lead in some instances a baby to have a reduction in blood and oxygen, which can lead to a brain injury. You can also have what we call nuchal cord. That's just a fancy way to say the umbilical cord is wrapped around the baby's neck. In a lot of instances, nuchal cord is going to be fine. So if your baby has nuchal cord, a lot of times it's going to be all right. But in some instances, some rare instances, if the cord is wrapped tight and you have umbilical cord compression, then of course you can have a reduction in blood and oxygen, which can lead the baby to suffer a brain injury in some instances. You can also have genetic things which can cause oxygen deprivation and developmental issues. So for birth injury attorneys and birth trauma attorneys like ourselves, like Renee and myself, what we look to help families understand is, when did this injury happen? Did it happen up during pregnancy, or was it something that the doctors and the nurses in the hospital that they caused? And if they're responsible, we help hold them responsible.